KEYNOTE-522 successfully advanced immunotherapy to the neoadjuvant setting for early triple-negative breast cancer. Looking back, what were the greatest therapeutic risks and clinical honors of using pembrolizumab, original a drug for advanced decision in early stage patients with current event?
So when you're looking at immune therapies and the pembrolizumab, this has been an amazing story because in triple-negative breast cancer, usually we would see a very strong correlation between the response of a neoadjuvant chemotherapy and the outcomes, meaning that patients who respond well to the chemotherapy and the tumor disappears have a very good prognosis. And these patients where the tumor doesn't disappear, they have a very bad prognosis. And that's also true for the KEYNOTE-522 study. But interestingly, specifically in the group of patients who did not achieve a PCR by a neoadjuvant treatment, including a platinum chemotherapy, an anthracycline therapy, and a taxane therapy, adding the pembrolizumab before and after the surgery actually led to a substantial improvement of invasive disease-free survival, of event-free survival, and as we've learned recently, also improved overall survival. And that's something we haven't seen before in that extent in triple-negative breast cancer in both groups, patients who respond excellent to the neoadjuvant chemotherapy, but also in patients who did not respond to the neoadjuvant chemotherapy. And it comes along with side effects. Of course, we have to take care of the immuno-oncology side effects, but improving event-free survival and overall survival is something we haven't seen so far in triple-negative breast cancer. Of course, subgroups like BRCA mutated patients with the olaparib, we have the Olympia trial, but in a larger scale, the immuno-oncology therapy obviously has contributed substantially to the treatment of triple-negative early breast cancer.